So what is the leading cause of death for both men and women, not just in the United States, but worldwide? It continues to be cardiovascular disease, specifically atherosclerosis, the plaque buildup in our arteries. It affects each and every one of us, either directly or through someone we love. So what can we do about it? The foundation of heart health has remained unchanged. Regular exercise, good sleep hygiene, a well-balanced diet with low glycemic index and minimally processed foods, keeping our blood pressure in check, and following two biomarkers. That's your ApoB. You should have 80 milligrams per deciliter or below, and some individuals lower, just to make sure your lipids are in the right place, and an Omega-3 index of 8 to 12%. So what is an Omega-3 index? It's a measurement of the EPA and DHA. Yes, those are the good omega-3 fatty acids you want in your body. It's a measurement of those fatty acids concentration in the membrane of our red blood cell. So our red blood cell lifespan is about 3 to 4 months. So you don't want to be checking this every 2 weeks. It takes a few months before we can stabilize and make any changes. Why 8 to 12%? Because the research has shown that if you can have an omega-3 index of 8 to 12%, you have a reduced risk of cardiovascular disease and death. And the contrary is true if your omega-3 index is less than 4%. There you have an increased risk for cardiovascular disease and death. Now these fatty acids are called essential fatty acids because your body can't really make them to any significant amount. So we need to consume them. The funny thing though is, even if you have a diet that's rich in fish, that doesn't always mean that you're going to have an omega-3 index of 8 to 12%. I certainly didn't. And some people will have a good omega-3 index despite not having a lot of fish in their diet. There's a genetic component to that. So it's important to actually get your numbers and know what yours is so you can move in the right direction if you need to. Unfortunately, the typical omega-3 supplement is in the ethyl ester form. Where what you want is not the ethyl ester form, but a re-esterified omega-3, also called a re-esterified triglyceride. Here's the difference. When they harvest the fatty acids, the omega fatty acids from small oily fish, and you want small fish because there's less chance of mercury contamination, they convert it to an ethyl ester form. And that allows a higher concentration of the EPA and the DHA, which is what you want, and that's all good. However, that should not be the end of the process. The next step should be a re-esterification of those omega-3 fatty acids, whereas they get the fatty acid and reattach it to a glycerol backbone, which is more like the normal condition. It sounds like a small change, but it's a big difference in how it affects you. The re-esterified omega-3s are more stable, less likely to oxidize and break down. They are better tolerated by your GI tract and better absorbed. They are less likely to have contaminants like mercury. They're less likely to smell or taste bad. In fact, if you ever have smelled really bad omega-3 supplements or tasted them, those are the ethyl ester form. Plus, the re-esterified version, once it's in your body, is more bioavailable. So I don't know about you, but if I'm going to take a supplement, I want something that's effective, meaning it's going to move the needle. I want it to be efficient, so I can take the least amount of capsules possible to get me to that 8 to 12% range. I want it to be safe, and I certainly don't want it to taste like fish or smell like fish, bad fish at least. And the next thing I want it to be third-party tested to make sure I'm getting exactly what I want and nothing I don't want. So work with your healthcare provider if you're going to take a omega-3 supplement to make sure it makes sense for you, especially if you're on any blood thinners. Omega-3, like aspirin, can affect your platelet aggregation. We haven't even discussed the benefits of omega-3 to the brain or other parts of the body. As with most things, if something's good for your heart, it's often good for your brain. So omega-3s have been shown to be beneficial for cognitive abilities as well as being neuroprotective, which is no surprise because DHA is in higher concentration in your brain and in your retina than anywhere else in the body. It is literally the bricks and mortar of your neuronal membranes. As an ophthalmologist, we recommend re-esterified omega-3 supplements to our patients with dry eyes, especially if the dry eyes are related to meibomian gland dysfunction or there's an inflammatory component to the dry eyes. The omega-3s have also been shown to be helpful in patients who have osteoarthritis and rheumatoid arthritis, decreasing their pain and stiffness. But I think personally one of the more exciting things about omega-3s is the interest in their anti-inflammatory properties. There's a growing amount of attention in this direction, especially regarding chronic inflammation. There's at least 3 different pathways whereby omega-3s either reduce or block chronic inflammation. Please encourage your friends and family to know their omega-3 index and get it to that ideal 8 to 12% and keep it there. The first step is, of course, you checking your omega-3 index. Thank you.